Welcome back to the Destroy Duchenne Podcast, a podcast aimed at telling the stories of those with a relationship to Duchenne. My name is Elijah Stacy. I'm a patient with Duchenne, the founder of Destroy Duchenne, an author, and I'm a consultant on behalf of Satellos Bioscience, as well as other biotech companies. Today, I have with us co-founder and CEO of Satellos Bioscience, Frank Gleeson. Welcome to the Destroy Duchenne Podcast.
Thank you, Elijah. Nice to be here. Looking forward to our conversation today.
So the first question I have for you is, can you share with us your journey before Satellos and what motivated you to step into the world of biotechnology?
Oh, I'd be delighted to do that. Actually, I've had a fairly lengthy and circuitous route to wind up in biotech and to wind up doing what I'm doing with Satellos. And throughout my career, I have always been curious. As a young child and early in life, I've always wanted to know why and drove everybody crazy. And eventually, that led me to understand later in life that I was always asking why, because what was really driving me was to get into a role where I could do something important, where I could actually contribute to others in a significant way. Eventually, after a corporate career and realizing, frankly, that big companies weren't the best fit for me because I was always looking around the corner, so to speak, for something more interesting, I moved into the venture capital world, which is what gave me exposure to the life sciences and to biotechnology. And I loved working with early stage science. I loved working with exploratory ideas that were different, that might lead somewhere, but also had risk. I don't seem to have the risk averse gene of working with things that are could be a shot in the dark, so to speak. And over time, I developed a relationship with Dr. Rudnicki through an interest that I had in the field of stem cells. That, of course, is his area of expertise, and we became quite close in terms of how we thought about stem cells from a therapeutic point of view. And over time, that led us to first one company and then a second company, with the second company being Satellos. So my journey isn't a typical one. I didn't go through the PhD science route. Quite the opposite of that. I went through business, but I found that probably if I went back in life and had a chance to redo it, I probably would have gone into science. If I knew then what I know now, I probably would have gone into science in the first place.
Yeah, I think that's actually really inspiring to me, your journey, because, I think you and Dr. Rudnicki make a great team. You coming from the business side and him coming from science side. And when you combine that together, I think that does something really, really special because, all these companies that you start, biotech companies, you can't do the science without, the business side of it.
Mm-hmm.
And so, you need them together. So I think that's really, really cool. My second question then is, what were the foundational ideas that led to the creation of Satellos? And how did you meet your co-founder? So yeah, about Dr. Rudnicki, how did you guys actually end up meeting?
Okay, so that's an interesting story, and it's through a body called the Stem Cell Network of Canada. So in our country, where I'm based in Canada, about 40 years ago, we began to establish what were called centers of excellence as a way to fund areas of science that were felt strategically to be important for the future. And because we're a relatively small population and trying to compete against countries with higher concentrations of people, we felt creating networks that would link scientists across the country might be a way to encourage not just collaboration, but to create the depth that was needed to move new ideas along. And so I became the chairman of the board of that network, which is still existing today and still prominent in the Canadian scene. And Dr. Rudnicki was recruited, I guess you could say, to be the scientific director at the time that I became the chair. So that's how we met one another. And we instantly realized that we shared a vision for stem cells that was apart from what was then the conventional thinking, and even today is largely the thinking, which is to think of stem cells in as vehicles for cell therapy. And we thought, wouldn't it be really cool from a therapeutic point of view if we could develop drugs, small molecule drugs, that could act on stem cells that are already in the body, not to proliferate them, which would be dangerous, but to reprogram them to act properly where they might not be acting properly. And so it was a wild kind of vision 20 years ago. But our inspiration was scientific. Our inspiration was actually EPO. And, EPO is nature's example of a regenerative medicine that's focused on stem cells. And it was really through, in a way, the abuse of EPO for sporting uses that the idea crystallized in our head that this concept could actually have legs therapeutically, not to do anything to do with abuse, not anything to do with EPO, but just this almost randomness of ideas coming together. And so we've literally been working on this idea for 20 years.
Yeah, no, that's super, super cool stuff. And I mean, if it works, I would classify that as revolutionary. And I think, people always throw out the word revolutionary. This is revolutionary, that's revolutionary. But I think a really good definition of something that's truly revolutionary is something that is industry changing. And
Mm-hmm.
so if you have regenerative medicine, I mean, that would change the way that we do medicine, the way that we treat patients. And so that's super cool stuff. And what was the breakthrough, right, that led to Satellos right now, by your co-founder, Dr. Rudnicki?
Sure. So Michael's expertise is understanding the regenerative basis of skeletal muscle. That's his field. And he has been a leader in that field for a long time now because he's made foundational discoveries related to the way in which muscle regenerates. And in particular, he characterized a population of cells called satellite stem cells and proved beyond doubt their existence and their capacity to divide in what's known as a pluripotent way to make differentiated cell types, i.e. skeletal muscle. And along the way, he became interested, he himself as a scientist became interested, not just in understanding how muscle regenerates in an academic vacuum, but in understanding how it might affect disease situations. And he became interested in that topic and then became interested in looking at muscular dystrophy because he felt intuitively, there must be a regeneration deficit. And great scientists have great intuition, and Michael has both great science and great intuition. And it's from that then it's the painstaking experimental work. And the foundational discovery was, in fact, that in muscular dystrophy, Duchenne in particular, there is a deficit in regeneration, and that deficit is related directly to the stem cells, the muscle stem cells that Michael had characterized, which means he basically discovered and proved their existence. And that was the foundational discovery. And he contacted me right away because we had a close relationship and had been doing business together to say, look, this one could be big. This one, we should do a company. And, he would only work with me, and I feel the same. I would only work with him. So we created a company idea around this, and that was the beginning.
Yeah, no, I think that's a significant discovery by Dr. Rudnicki, and what that can translate to is pretty life changing for patients. With what Satellos is trying to do, if it works. And I think just for our audience, we talk about dystrophin a lot, and we know that dystrophin is important to protect muscle, but in this case, it's also important to regenerate muscle. And
Right.
so it does two things, right? and Satellos was looking at trying to do the other half of the problem, which is to regenerate muscle.
Right.
So it's important to make that distinction.
Right.
Um, Moving on, what were some of the challenges when you did start Satellos? The biggest challenges in its early stages.
So the number one biggest challenge was challenging scientific convention. So, I suppose I tease Michael that he's a modern day Galileo or a Copernicus who was challenging the heavens back then, literally. And, it doesn't end well when you sometimes are challenging orthodoxy in that kind of way. So that was the biggest initial challenge. Michael faced it in a little bit, I believe, in the academic world and the scientific world. And we certainly faced it together in the world of dealing with the venture community and dealing with the pharmaceutical community who weren't immediately ready to accept this could be true. That's number one. And then number two, which goes along with that, is for something that's an idea that you can't prove because it's an idea and a concept. So you can't prove it in human until you get there. How do you get enough evidence that you could actually do this before somebody would be willing to support the idea? And so that's almost like a catch-22, that we faced, and it took a fair bit of time. It took 2 or 3 years of pretty hard work on our part, and Michael's on the discovery side, and our part together to start to gain some currency that this idea could be put into practice. That we really could do this. That we really could figure out how to drug stem cells inside the body, how to target them. How not to create unwanted proliferation if we were able to target them, and so on. That took a lot of work. So that was hurdle number two. And then hurdle number three was, of course, the rest of it, actually finding the drug target, inventing the drug, getting the data on the drug so that we could, move this into clinical development. And those are the big three. And along the way, we have been a little bit lucky. We've had a few, blind alleys we've gone down. We've fallen into a few manholes. But now, we look at it that now we're ready to soar. So we're happy we stuck it out. We've been able to recruit some wonderful people to our team to work with us, who share our passion and aren't afraid to take a risk. And now we're close to our dream of getting this into human beings and seeing if we can make a difference.
Yeah, no, it's definitely facing a small if odds, right?
Mm-hmm.
Overcoming when the odds are against you and pushing through and trying to make it happen. How did you? I'm so curious. How did you convince people with a lack of evidence? As it's just an idea, as you said, or some of those challenges that you mentioned. How did you overcome those?
Right. Well, I've been doing business for a long time, and I've been in many different roles in business. And the one thing that I've learned over my career is you always have to have faith in yourself. And I don't mean that out of a sense of arrogance. I mean that if you really truly believe you're onto something, then you have to make sure other people understand that you believe that. Because really, we're trying to do other people a solid, so to speak. When we go to investors with an idea, if we're right about our idea, they're going to make money. So, I learned that from life, selling stuff, that you actually have to have the mindset that you're trying to help the person you're asking to help you, right? And when you think of it that way, it makes it easier to keep going, number one. And number two, sooner or later, you actually start bumping into the people that are willing to give you a little bit of credit or to take a risk on you or take a risk on your idea. The first to do that were our colleagues at a firm called Bloom Burton, Brian Bloom and Jolyon Burton and John Holyoke, three people, the vision and courage, who said, this is a big idea and it's a powerful idea. And we're willing to work with you to see if we can help build a company around it. And you need that. You can't do everything on your own. So you have to be willing to share. So Michael and I, from the beginning, have had the view we will share. Because at the end of the day, if we're right, this is so powerful. Everybody's going to be happy. Whatever objective you had for this, if you were the money guy, you'll be happy. If you're the inventor, you'll be happy. If you're the business builder, you'll be happy. And obviously, if you're the patient, we want the patient to be happy. That's really what we want. So we tried never to lose sight of that it isn't about us, it's about making sure we can do this. So let's find people that want to work with us. And once you start, I don't know, once you get going in the right direction, things sort of come your way a little bit. You get, luck follows you a little bit once you start going in the right direction. And never, you can't doubt yourself. You can't just have wild, stupid thoughts and expect everyone to follow you. But you can't doubt yourself, and you can't doubt your company, and you can't doubt what you're trying to do. And we're getting closer and closer to the point that we'll all find out together if this can work. We think there's a good chance it can work, and if it does, then a lot of people are going to benefit.
I think every person my age, I'm 22, should listen to that last segment. That is incredible. I mean, that's a story, but it's also incredible advice. You have to believe in yourself. You have to keep going and going and going, and eventually somebody will catch on. And once you build that momentum, other people will start to catch on. It gets easier as you go, and it gets more exciting. And so, what you just said is so beautiful, and that was really good. I appreciate that. That's everybody needs to hear that. Going on, how do you transition, right? So did a lot of the hard work, coming up with the compound and all this, but how do you transition from breakthrough science to developing an actual drug that you can try in clinical trials?
So the first thing that you have to always remember is that it's not the breakthrough, it's how you use the breakthrough, right? So if you can characterize it that way, and everybody on the team can get around that thinking, then the next step is the purpose. Making the drug is the purpose. It's not the boring bit. It actually becomes the exciting bit. Because now, as you move to inventing the drug, you have a whole new set of scientific challenges. Not only do you have to figure out chemistry, you have to figure out intimately how it interacts with biology. You have to figure out what it might be doing you don't want it to be doing, so that you can correct for that. You have to figure out how can you see through surrogate markers you're having the effect you want. And then how do you design the experiments? How do you think about how you're going to give this to human beings? These become a whole new set of really exciting challenges, because no one's done it before. What we're trying to do to regenerate tissue, no one has tried to do that before with drug, with the exception that I said earlier about EPO, which inspired us. So for us, it's easy. It's actually easy to make that transition, because it's part of what we want, right? It's like, you want your children to become teenagers, even though they'll drive you nuts. You want them to become teenagers, and then you want them to become successful adults, and so on. And trying to build a company and make a drug, it's very much like that. Michael, for example, he didn't just hand off the science to us and say, okay, it's over to you, because figuring all that stuff out's boring. No, and I didn't want him to, but he didn't want to either. So, we talk as much now as we did 6 years ago when we started the company, because all of these intricacies need a lot of thought. And so, as I mentioned earlier, we've put a team of people together with all different backgrounds and skill sets, but who like to think things through, and like to think out of the box. And, personally, I think it's really, really cool because, as I said at the beginning, I'm curious. So I like that. I'd love to have whiteboarding sessions, or I don't know what you call them nowadays. In my day, they were called whiteboarding sessions, but those blue sky, discussions. I love them.
Yeah, no, I mean, I'm a personal believer as well that, like, when you just get people together who are curious and who are knowledgeable, you just start just discussing the same idea, it leads to more questions, which leads to more, progress or ideas that can
Totally.
benefit it.
Totally.
So,
Yeah.
um, what do you think, you personally, the potential this has to help Duchenne patients, or how do you think it will help them?
Yeah. So we genuinely believe that our drug has the potential to restore muscle tissue. So what we mean by that is that the mechanism that we are modulating is the most basic beginning of the process of repairing muscle. So our muscle stem cells are programmed, and the intent of the program is to repair damaged tissue. It's to, early in life, it's to create the tissue in the first place and continue to create it as we grow. And then as we damage it through our daily activity, it's to repair it. Repair it by bringing back muscle tissue, by making new muscle cells. So it's actually a very, very simple concept. Of course, nature is very complex, but it's a very simple concept that as we damage our muscle cells, the fibers are actually muscle cells. As we damage them, they're prompted to repair themselves. Skin does that too. But in the case of skin, we can watch it, right? Because we can watch the clotting process and so on. But in the case of muscle, we can't watch it because it's inside. So we believe that we can restore that, which means that in the best case scenario, that we can not only slow down the damage that happens, but we can stop it. And in some cases, we believe we can reverse it. We believe that's the potential. And this is what we've seen in animal models, that we make a significant impact on the regeneration of new muscle cells. And that, we believe, can be hugely powerful. Now, truthfully, exactly how that translates into, what does that mean for ambulation? What does that mean for upper body? What does that mean for the diaphragm? We can speculate, but until we get there, we can't say with absolute certainty. But we believe that we can help at many stages of the disease, but in different ways, right?
If you don't mind speaking about it, can you tell us a little bit about the recent preliminary data regarding canines?
Yeah, so we worked with a collaborator at the University of Missouri who has a colony of dogs that have muscular dystrophy. These are dogs that had spontaneous mutations that led to muscular dystrophy. So they're, in many ways an ideal population to look at because they have diversity in the colony. They're not all entirely homogeneous and so on. So in some ways they represent, what humans are, where everybody's different and everybody may manifest the nature of the disease a little differently or at different speeds and so on. So we were fortunate that Dr. Dongshen Duan was able to make a couple of animals available to us to do a pilot study. Now, when we started the pilot study, which was intended to be a 4-month treatment of these 2 animals, we still were working out, the parameters of our drug, how to dose it and how long to dose it and how concentration to dose and so on. And so we basically, honest to God, had to guess what we were going to treat these animals. So, what dosing paradigm for these animals, and kind of hope for the best. And so, you don't want to do an experiment that way, but that's biotech sometimes. You give it your best shot and hope. And so we treated animals for 4 months. Before we treated them, we measured some of their physical properties, and we took some biopsy material where we could do so without harming the animals so that we could test later. And then we measured the animals, the same kind of parameters, at 2 months of treatment, and then again at 4 months. And the interim data that we reported was when we had 2-month information available. And I can now tell you, Elijah, that we have just received the 4-month information, and we're analyzing that. And what we have shown is that in these animals, in now different tissues of the animal, we have seen that we've had a significant effect on new muscle generation. So we clearly have a drug that's active on the mechanism that we're trying to modulate, and that is doing what we thought it would do, which is to lead to new muscle cells being created. And so we can now say that with real conviction that that's what we've done in the canine, both of the animals that we tested. We can also say now that their limbs, particularly their hind limbs, we're still analyzing some of the other data, were stronger after 4 months than they were at the beginning of the experiment. So when comparing, treated after 4 months to baseline, they're better. We saw it at 2 months, and so now we know that what we saw at 2 months was sustained and increased over the following 2 months, which is also very, very encouraging to us, because it means that our treatment has the potential to keep improving, right? So, we as a company are just thrilled at the data that we've seen. We recognize that it's only 2 animals, so we cannot say we've cured anybody or anything. But what we believe very deeply is that the process of restoring regeneration has the potential to be impactful. And now we've seen very clearly in the mouse model, and we've seen it now in the dog model, that we're doing that. That is what we're doing. So we believe that our mechanism of action is robust. And that, I've been doing biotech for 30 years. You don't often see that, frankly.
That's no, really, really encouraging to hear. Can you tell our audience why it's important to test drugs, particularly with muscle, across species, and in particular with canines? Again, their muscles, being similar to human. Can you speak on that?
Yeah. So I think most people would understand that we need intermediate steps before we can go into human beings with ideas and with new entities that are foreign to their bodies. That, is, science was done that way hundreds of years ago when people didn't know any better. But it's not the way we do things now, because there have been some very bad examples in our history over the last 100 years or so. So we can't do that. So it is a step-by-step process, and sometimes these steps take many years. And so that's frustrating. That can be very frustrating for everybody. It can be frustrating for the people waiting for the treatments, more than it is for anybody else. They're of course the ones that really need the help, and we're trying to help them. But it's frustrating for us as well, because we would like to go faster if we could. But the first step is to try to figure things out in test tubes, and try to figure things out in laboratory dishes and so on, and then to move into model systems And in this case, it's generally rodent systems are the first model systems. Sometimes it could be gerbils or, guinea pigs, but usually it's mice and rats and so on. Because essentially you can control the conditions. I mean, this is why we use those systems, because they can be bred, they can be genetically typed and bred to be identical. One after the other, they're identical. So you don't get a lot of variability inside the experimental cohort. So if you have 5 mice or 10 mice or 15 mice, they're all the same. So that they allow you kind of to do a little bit of an assembly line. You can test things rapidly, and you can get data that is repeatable and consistent. Now that's great for taking idea from a test tube to start to get some sense of what it is like in a mammalian system, in a living system. But humans aren't identical. Humans have massive heterogeneity. So no two of us will respond to, frankly, any drug in exactly the same way. It may be pretty darn close, but it actually won't be exactly the same way. And of course, the more severe an illness is, the more that heterogeneity can prevail. So the reason to go into a larger mammal, such as a dog in this case, is the heterogeneity, because the dogs do a much better job of representing the heterogeneity that humans have than the mice do, because we're not working with wild type mice. We're working with mice that have been specifically bred to be laboratory animals. And they're bred for being basically identical. Whereas the dogs, even though they might all look the same because they're the same breed, there is heterogeneity in their systems. And so it's that heterogeneity that we want to understand a little bit. So this is why people always say, well, how many did you do? Because they want to know that you've covered heterogeneity. That's really what it's at, that you didn't just do one and it's a fluke and it won't represent a bunch more. So even though it's only 2 animals, we're still really pleased, because these 2 animals were different animals. I mean, the same breed, but they're different animals. And we saw the same kind of output. And so we're pretty excited about that. But that's why. And different diseases use different larger mammals. Sometimes it's people, different areas they might go into, non-human primates and things like that. But A, we don't need to do that in this case, and B, we don't think it would be appropriate to try to engineer this situation in non-human primates. Whereas in the dogs, there are colonies that have arisen spontaneously. So it's I guess you could say it's a more acceptable kind of model.
No, that makes sense about, having to look at all the complexities of it and see how that works. Kind of the last question about drug development in terms of the science part is, how do you ensure that a drug candidate's safe, its safety and efficacy before, starting a clinical trial with patients, with humans?
Right. So there are many ways to look at that issue. And there are many rules of thumb that have been built over the years from experiences of the past. And so there's a great body of knowledge already pre-existing about chemical structures themselves and aspects of chemical structures that could give rise to toxic effects. So chemists know nowadays to build away from certain types of atoms being on chemical backbones. And so you start with that. The second thing is, nowadays, drug discovery nowadays starts from biology. And in the old days, it started more from chemistry. Companies would find something that was active and then find a biological system that it worked in. Nowadays, it's the other way around, largely, almost entirely, but certainly largely. So in this case, what was important for us was to find the target, the enzyme that we're trying to act on. And then one can build structures, 3D structures of that enzyme, and then can model them digitally and look for the area of that enzyme that we want to touch with a chemical structure, so that we then limit the amount of interaction we have with that enzyme, so that we're as specific as we possibly can be for the objective we're trying to achieve. And you try to design your chemistry so that it doesn't touch near neighbors. So you stay away from other entities that you may not want to touch. So it's really all in trying to understand the biology. You can model a lot of that digitally. You can test it in test tubes or in laboratory dishes, in tissue, for example, that's been excised from an animal. Then you can go into live systems. And so you do an awful lot of this work, coupled with all of the background tests that have been built up over the years as sort of the gold standard of things you need to do to test for, does it have any impact on the heart? Does it have impact on the brain? Does it have impact on the liver? Does it have impact on reproduction? All of these kinds of things that there are batteries of tests you can do. So by the time you get to the point that you file to start a clinical trial, frankly, you have a really good sense of whether you have something that's going to be tolerable, and you have a really good sense of how far you can push dose. So when you go into people to do your safety studies, as we will start in a few weeks, as we get approval to do so, you have you're supposed to have a really good sense of where you might see some toxicity and the level of toxicity you might see. So it's almost as though those studies should confirm your understanding. And if you get a real surprise, of course, that's not a good thing, but that's why you do it, to make sure that there isn't a surprise that could be harmful. Because really, you don't want to be harmful, right? You want something that is going to be helpful and isn't going to be very difficult for the patient to deal with, because the patient is dealing with enough already. So that's what we're trying to do. That's what everybody is trying to do. We're not alone in that. That's how drug developers think about it. And right now, we believe that our drug is going to be quite tolerable, has the potential to be quite tolerable, and to have a fairly wide therapeutic window.
When you're developing drugs, can you also base or get a good sense of its safety based on other compounds that are similar to it?
Yeah, so you can look for other chemistries that are similar, and obviously, if someone else is drugging the same target, and in this case, our target, there is another program in neuropathic pain by another company that is going after the same target. Slightly different approach to how it's inhibited, but the same kind of idea. So yes, you can get pretty good sense, but still you have to test your own molecule, because your own molecule is unique, and there may be something about it that makes it a little different, makes how the body metabolizes it a little different, or how the body reacts to it a little different. So you can't cut corners, but you can get comfort. Let's put it that way.
Okay, yeah, that's very informative. My next question is kind of changing it up a little bit, but how does Satellos engage with the Duchenne community, and why do you think engagement with the Duchenne community is important?
Well, we have started to engage for quite some time. We have been working with Parent Project Muscular Dystrophy, for example. They invested in our company. We were their first philanthropic venture investment. And we built a relationship with them, and most recently presented at their annual conference at the end of June. And through that, we've become, exposed to many families, and that has been powerful for us in the sense of, one, it helps us understand at a very deep level what is important in a drug in this disease area. It's very inspiring for us because we have had, as a little company, some dark days when we weren't sure if we could break through some challenges. And we think we can't give up because now we've come to know people that think this could help them, and we think it could help them. And finally, at some point in the not too distant future, we will also want patients to volunteer to be in a clinical trial for our drug, and we want families to feel good about that. That that we're a good citizen, and so the only way to do that is to get to know people, and so we're trying to do that. We would like to expand and become more involved with other of the advocacy groups. So we will start to work on that next. And hopefully they will also be receptive. And of course, through individuals such as yourself, Elijah, we've come to develop close relationships, friendships, and we hope to expand on that. So, this is a people. Again, I learned this in business, in other businesses that had nothing to do with trying to help cure a disease or treat a disease. Business is about people. Doing business is about interacting with people. And what could be more people-oriented than trying to help improve someone's health? I mean, that's the most people-oriented thing I can think of. So we like it. we like interacting with the community. Actually, we enjoy it, and we really, really, really hope we can help.
Yeah, no, I think that's all you said is so perfect. Like, trust and familiarity is so important with any type of relationship. And so, biotech having a relationship with the patient community and vice versa, it does a lot of good. Like you said, inspire you, motivate you, give you insight, right? All
Mm-hmm.
these different things. How does Satellos think about strategic partnerships and what is their role in advancing drug candidates?
Yeah. So right now, our vision has been to invent the drug and show some proof of concept that this could be beneficial. So we've invented the drug, and we have proof of concept now in two completely different animal species, the mouse and the dog. We really want to show in people the potential to have a benefit. And we would like to do that before we think of a corporate partnership with a third party. At the same time, we are very mindful of how complex this condition is, how it affects people quite differently at different stages of their lives, and how many different subsets of patients there could be. So we may need partners and help to make sure we address all of that. So we are reaching the point where we feel more comfortable to have collaboration discussions, and we will entertain those over the next year and see how they evolve. But it's with the vision to be able to reach more patients, not give up our company, but to reach more patients. So we view this the same way as we view working with the patient community. It's about collaboration, it's about sharing, it's about finding ways to work together to expand the opportunity for everybody. And at some point, we will need help by bigger entities for sure. Yeah.
I think that makes a lot of sense as well. How do you balance the scientific and business aspects of running a biotech company, specifically as a CEO? That's what I'm curious about.
Right. Right. Well, I look at them as one and the same thing. We're in the business of science, and science is our business. So we have to always talk about both things all the time. And that's tricky because sometimes the natural thinking is, well, why does the finance person have to be in the room when we're talking about the science? Or why does the science person have to be in the room when we're talking about the clinical trial plan? And my view is you're a team. You're a team of people. It's like, you're trying to get around the world in a small boat and there's a team, and you don't want the captain and the person who's manning the sails, and the person who's reading the maps not to be talking to each other all the time. We want to be talking together all the time. And then it just makes it a lot easier to realize that it isn't about the clinical plan or the science or the money. It's about all of them all the time because they overlap. And, when we think about the clinic and we think about what are we going to measure in the clinic and what the markers might be, that takes us right back to the science. And if we don't have the scientist in the room, we're actually just holding ourselves up, so to speak. So my view is it's all the same thing. And what we need to do is make sure that everybody on the team is capable, not of doing everybody else's job, not that at all, but is capable of enjoying the dialogue, being curious about what we're trying to do, and listening across disciplines. And you never know where the good idea is going to come from. You absolutely never know. It has never failed to surprise me in my career that an idea comes from an individual or a department that you just wouldn't have expected. And so my view is if you have really high expectations for people and you give them scope, they achieve those high expectations and do it quite happily, actually.
Yeah, I think, like we were saying earlier, when you put smart people together and just let them talk, good things happen. Talking
Yeah.
to good things. Speaking of that, what qualities do you look for when assembling a team of high performing people for a biotech company?
Yeah. So I look, I look for people who want to work as part of a team. That's the most important thing for me. Number one. Um, Obviously, you want to hire people that are smart and that have expertise and experience and all of those things when you can find them and you need them. But the most important thing for me is that they want to work as a team, that they enjoy that. Um, the next is that it's about it's about others, right? It's about what we're trying to do. We're not the important part. Um, what we're trying to do is what's important. So ego needs to be contained, preferably checked at the door, but contained. So I have found that finding people who are comfortable to all feel if we succeed as a team, then we've succeeded individually, as opposed to the other way around, that if I've succeeded individually, I'm happy. No, I want people that feel good about the team being successful, and then we can all be successful. And so that's the number one characteristic for me. Um, over the course of my career, I've been really happy to place bets, I guess you could say, on people with unusual backgrounds or different backgrounds because I just felt they met that profile. They're team oriented, they're smart, they're curious, and we'll all make it work. And usually it does. And whenever I've gone out of that sort of box because I needed to get somebody with very particular expertise, and I'm okay, well, this person might not be a good team player, but we'll try to make it work. Frankly, it never works. You know, and every company is different. Some companies are build a model differently, um, but that's our model.
No, I like that. I like the thinking outside the box, just like you talked about
Mm-hmm.
earlier. That's what
Right.
you really practice what you preach.
Mm-hmm.
A few more questions for you.
Okay.
These could be quick answers if you want. Um, how do you foster a culture of innovation and creativity at Satellos? And what kind of culture are you looking for? You kind of just talked on this, but how do you actually foster that?
Well, I have found that innovation and creativity require an environment that's not judgmental. And it has been the hardest part of my business journey to learn that lesson and to allow that lesson to basically change how I manage people. Because the more structure one places on individuals, the more one has a culture where mistakes or errors get sort of reprimanded or get somehow written down in a performance review, the less you breed a culture where people are willing to take risks and are willing to think differently. So what I've learned is the easiest way is how you pick, who you pick, how you pick them, and so on as team members, but then not to focus when things go wrong on the fact that something went wrong, not to focus on the fact that a discussion may have sort of wandered off and is maybe spinning the wheels a little bit, but to always allow people the comfort and the safety to say what they want to say, obviously in a respectful way, and a little bit of rope to go and do things that are different. And again, I've always found that if you have a team of people of goodwill, someone's going to solve a tough problem by waking up in the middle of the night with an idea, and you want that person to act on that idea. At least I do, and then see what happens. Rather than everybody fretting about it and stressing about it and feeling pressured about it, let's allow people the freedom to think about it and experiment, and because we're in the business of experimentation.
What you just described, I could say, as a consultant, that's exactly how I would describe it. Been many moments where even me, like in the middle of the night, I'll wake up with an idea, write it down, and then talk to whoever I'm meeting with next. And yeah, that is exactly the culture at Satellos for sure. So, that's the vision you have, where you've done a good job fostering it. So that's really cool to know. The last three questions I think are really deep, and I'm really interested to know what you say about them. So you've been part of a lot of different businesses, a lot of different things. Looking back, what is one lesson you learned as CEO or in your business experiences that you wish you had known at the beginning?
So I think the most important thing is you don't have to have all the answers as CEO. In fact, it's better if you don't, as strange as that may sound. What's really important as the CEO is to know what kind of questions you ask. It's really, really important to know what kind of questions to ask. And it's really important as CEO to let go. The greatest, what I have found, and again, this is the toughest lesson I have had to learn as a CEO or getting to become a CEO, is letting go actually leads to greater loyalty and greater progress. It just feels so intuitively backwards to me for most of my life, and sometimes you can see it in others, in other fields. But to me, as soon as you give people that sense that you're comfortable with them following their instincts in the context of what you're trying to achieve as a team, amazing things happen. And being the leader is easy. It gets really easy. But when you're always worried about whether someone's doing what you want them to do or doing it the right way, well, you chew up a lot of your own time, and time that you should be spending thinking about strategy in the future, you're thinking about the wrong things, because most people just want to do a good job, frankly, especially in this field. I mean, in the biotech world, I think we're all very fortunate that we're dealing with, generally speaking, people of really high caliber to start with. So get out of their way. But as I said, that was a tough lesson for me. It took me a long time to figure that out.
Right, right. So basically, in short, don't micromanage. Let people be great. Let people,
Let people
you
be
know,
great,
yeah.
and if someone is clearly not a fit, most of the time they figure it out, actually. That's been my experience.
Mm,
Most times
mm,
people figure it out
mm,
because they want to go somewhere where they will be a fit.
mm. Yeah, no, you're right. Everybody is very high achieving, wants to do great for themselves. Um, what is your vision for Satellos for the next 5 to 10 years? Where do you see it going?
So I absolutely, all of us at Satellos absolutely want to see us getting into Duchenne patients and getting a drug approved for Duchenne patients. So over a 5-year period, as you said, vision number one, get our drug approved for Duchenne patients. Whether we do that alone or with a partner, that's number one. And we think this has huge potential in other areas. So we've already shown data in FSHD. So we're very keen on expanding into other dystrophies. So that's also part of the vision. And we have also, as you know, Elijah, shown in injury situations that our approach may have the potential to accelerate recovery. And so we want to broaden this to a larger set of applications. So that's where we are with drug development. We're in the process of assembling a really terrific scientific advisory board of luminaries in the field of regeneration more broadly, because we think the concept of regeneration can be applied to other organ systems in the body, and we want to be the pioneers for that as well. So it's a big vision, but without doubt, the number one mission is to get a drug approved for Duchenne muscular dystrophy.
I think that's a fantastic vision, and that's exciting. I always think that you want to be a part of something or do work for something that excites you. That you want to see happen, and what you outlined. I mean, I don't know who wouldn't want to see that, right? So,
Right.
um, that's just universally great for everybody. Lastly, what has been the most personally rewarding aspect of leading Satellos?
Um, Honestly, Elijah, it's been meeting people like you. That is the most wonderful experience I've had in business of any kind. And I wouldn't change that for anything. And I hope to meet more people such as yourself, and see you and others flourish. And almost everybody, I think everybody on my team feels the same way. That that's that's the best part of Satellos.
Well, I really appreciate that, and I mean, yeah, it's been a life changing experience for me, and so the feelings are mutual. It's been really really cool to meet you guys all, and I normally don't say this, but I genuinely love the people at Satellos, like love them. Um, they're just so smart and so welcoming and so curious about the world and wanting to make things better, and so personable. It's just I genuinely love the people at Stella. So I appreciate all the time today. Thank you so much for joining us. This has been really really cool. I think the audience is also going to send in feedback and say the same thing. But this has been really really cool, and I hope to see, as you said, this drug in patients with Duchenne and see it work. So so thank you again for coming on the Destroy Duchenne podcast.
Elijah, thank you. Thank you for your thought-provoking questions, and for being you. And I look forward to seeing you in a few weeks in Riverside at your annual event. So
Sound
a few of us will be there. My wife will be joining me as well, and I look forward to seeing you and your family.
Sounds good. Thank you so
Okay.
much.
Thank you, Elijah. Bye now.